Welcome to today's episode of Talking Tinnitus, presented by Lanier. We're here with a very special guest, Dr. Shahzad Cohen from Hearing Loss Solutions in Los Angeles.
You're having me.
So Shahzad is a qualified audiologist and tinnitus expert, actually an executive board member of the American Tinnitus Association and advisory board member of the California Speech and Hearing Association. So I'm delighted to have you.
Thank you for having me.
So today's topic is, can a patient be too old to have their tinnitus treated? So can they be too old?
If you ask me, you're never too old to get your tinnitus treated and find relief in life.
Super.
So if your tinnitus is bothersome enough to bring you to want to get help, I would say you are open and you are willing to put up the work, then no, you are not too old to get treated. Just like you're not too old to learn a new habit in life, or you're not too old to learn a new language in life. It might take a little longer because you're not learning as fast, but no, you're never too old to learn anything new, and you're never too old to get your tinnitus treated and find relief in life. Tinnitus is something that is bothersome. So removing something bothersome in life brings you peace, and you're never too old to have peace.
Never too old to find peace. It's a good message, I think. So I know, tinnitus and hearing loss can be kind of separate things, but for some people, hearing loss might be a precursor to tinnitus and age-related hearing loss potentially. And so I assume it is relatively common to see older patients in your practice, is it?
Yes. So you know what I usually tell my patients is that tinnitus and hearing loss are two separate problems.
Sure.
Brother and sister of the same family, but two separate problems. You got to deal with them separately.
Yeah.
And then it could be that one feeds into the other, just like brother and sister who tease each other out,
Course,
right?
yeah.
So, or trouble each other, but still, each one needs to have their own room, why they get treated separately. There are many patients that by the time that they get older, their tinnitus is not the main focus of their life anymore, because at that time they have lived with the tinnitus for so long.
It started to habituate.
Habituated over the long time. But in most elderly patients, what we see is that because of the change of the medications, that's what that causes a spike or a problem with the tinnitus.
Okay.
So in most of the patients that I see, yes, the hearing loss, especially the sensory neural hearing loss in higher frequency and lack of external input might be a reason that the tinnitus spikes, but most often the fluctuations that I see in my geriatric patients is because of the medications.
Okay.
So, and that's why the first thing that I do is that I review their medications. I contact their physicians and I go like, can you tell me which medication was just changed? Or I'll have the patient go to their pharmacist and discuss any of the medications that I have. Could they cause a fluctuations, or could they have a tinnitus as a side effect?
Okay, interesting. So I think there was some recent research, and data published by Lanier. The average age, I think, of the participants was about 60, which might be representative of there has to be people above the average to arrive at the average of 60. And what's kind of the spectrum of age groups that you have in your practice? It seems like there could be a wide scope there.
Yeah, I'm lucky enough. The youngest person that we saw last week, actually, they brought her to our clinic, is 6 years old.
Wow.
And I usually do not see pediatric patients. Yeah. However, because this is a tinnitus patient and we do not have a pediatric tinnitus specialist in our area, I accepted the child to the practice. And the funny thing is that she doesn't know obviously what tinnitus is. She just keeps on telling her mom that my room makes a squeaky sound. So it's very different. That then you gotta sit down and bring yourself to that level to understand what that is. And then the oldest patient in my tinnitus clinic, I believe he is maybe 96 or 97.
Wow.
something right there. And it's a gentleman who is so well dressed, so amazing. And, is such a dapper guy every time that he comes in, such a gentleman. And he actually came in with the problem of tinnitus. And he goes like, do something. I have my life to live. I want relief. Exactly. So, and you know what? Successfully, we have actually been able to treat his tinnitus. And, surprisingly, linear is the one that we used for him. So usually, what people will say, hearing aids and all that.
Yeah.
He already had his hearing aid in place. He already had everything. And when he come over like, I know the best device for you. So surprisingly, we suggested linear, and he's doing very well with it.
That's fantastic to hear. That's magnificent. So I think without a doubt, that sends a clear message that, you're not too old to have your tinnitus treated.
Never.
You're not too old in life to find peace. And I think if you want to find that peace, finding a tinnitus expert in your location can get you on the path towards that.
Absolutely. Amen to that.
Super. Thanks for your time today.
Thank you so much for having me, Neil.